Thank you for inviting me again to this important annual event. Dear colleagues, dear Professor Milanov, I did not expect to be so far away and speak, but anyhow, we'll manage to have a successful event. My duty today is to speak about the medication overuse headache and to see how can be the practical approach to the patients that we find almost every day in our daily routine. The clinical description of medication overuse headache is concern headache that is as a frequency of daily or almost daily use of medication. The character of pain in most of the situation is pulsating, but it may also be a dull, diffuse, overall headache. The intensity of pain can be from mild to moderate, but sometimes you may also have some severe attacks on top. Pain usually is unilateral. And the associated symptoms of what can be migraine or other headaches sometimes is missing because the patient takes medications right away. Sometimes there is also neck pain. You don't have only headache, but neck pain is associated. And this is the reason why patients carry out unnecessary and costly neck intervention and examination. And in most of our patients, we have a typical wake-up headache, and sometimes they have also night withdrawal from a strong headache during the night. Along with this continuous pain, you may also have some migraine-like attacks on top. The clinical description that we may see in the current classification from cephalalgia in 2018 rely upon a medication overuse headache that is in most of the cases an interaction between a therapeutic agent that is other triptans or non-steroidal analgesic drugs or other combination of medication, and there is a meeting, we must say, with a patient that is susceptible to be in overuse. In most of our situation, the headache at onset of medication overuse headache is a migraine, but it may also be a tension type headache, or sometimes you may have both of them. How can we define medication overuse headache? It's a headache according to the classification that occurs more than 15 days per month in a patient that is suffering from a pre-existing headache. And in these patients, we have a regular overuse that lasts more than 3 months of one or more drugs that is taken for acute medication of an attack. And of course, you have to rule out other conditions connected with this headache and lasting headache time. The medication overuse involves several kinds of medication. We may have ergotamine overuse, triptans, simple analgesics, opioids that are coming more and more in our routine, and you may also have a combination of analgesics, for example, paracetamol, codeine, and so on. But you may have different drug classes that are overused by the patients, or sometimes the patients tell you that he takes a lot of drugs, different drugs, the drugs that he can find at home, and he's running into a medication overuse headache. If we consider the epidemiology, you may understand that this is an important issue, the one that we are speaking today. We think that probably 1 to 3% of the general population is affected by medication overuse headache, and in the headache center and the specialized clinic, you may see up to 30% of the patients suffering from medication overuse headache. This kind of headache is more frequent in females than in males, with a ratio of 3.5 to 1, and mostly it starts around 40 years in our patients. We also have a report of prevalence of medication overuse headache in children and adolescents. More and more reports are coming in this respect. And according to what was a survey on GP, medication overuse headache is probably the third most common headache in this report. But if we consider the local medication overuse epidemiology, probably we should start and see how is the situation in Bulgaria, so you may understand why it's important to speak about this headache. In 1981, when Professor Milanov graduated, the population was high in Bulgaria.
How do you know this?
I checked in the internet.
Mario, do you have a presentation or you just speak? You have to share the presentation if you have.
Yeah.
Slide?
It's not shared?
No.
Anything?
But I was not sure if you will only speak without presentation or so.
Let's see. I'll see. Can you see now my screen?
No.
Well, then we should do something.
Sure. There is share down, very down on the screen. There is a green button.
Reaction, security, disactiva.
Security, participants, chat, share.
Invite, vista, registration, information.
No, down.
Zoom us, it says. Invite, other, chat, share the screen. Here you have it.
There.
Is it correct now?
Yes.
Can you see everything?
Yes, you have to put play.
Yeah.
Maybe.
It's okay now?
Yes, play up, yes.
Now
Perfect.
you see it.
Perfect.
You have not seen anything before. Well, it's okay.
No, but it's okay, because in fact you explain it, so no problem.
So, as I was saying before, in 1981, when Professor Milanov graduated, at that time, the number of medication overuse headache was sometimes, if we consider 1 to 3% of the population, around 2,000, 2,500 people. But as you may see, the number of Bulgarians is decreasing along the time. And up to now, with the population estimated in 6,800,000, the number of medication overuse is reduced consistently, more or less, is sometimes less than 2,000. And in 2030, when we may expect that Professor Milan will retire, the number will be so reduced. So we had to do something before that age, and we had to understand how to treat our patients. If we want to see the MOH identikit of a typical patient with medication overuse headache, we said that in most of the cases they are women, they have a lower educated level, they are unemployed, have migraine remission during the pregnancy. Sometimes they are in menopause, constipation, and do not use oral contraceptive. And in most of the time, they use some other drugs like sedative or antihypertensive drug. So this is an important identity to see our patients. But the problem comes also from an economical point of view, because probably this kind of headache is the most expensive one for the society and the people that are suffering from headache. In Europe, we know that there is an indirect cost that is imply reduced productivity and absenteeism from work, and this is in about 90% of the cost for this kind of headache. We know that the individual cost is very, and the national cost of this kind of headache is much more than the one that we have estimated for migraine. And if we see the costs for Italy, Spain, and France, there is something like 5 to 10 billion per year. But what is important is that if you treat properly, and the medication cost of this headache is drastically reduced. But this medication overuse headache is not only something the patient is suffering from, it is also a condition that imply changes in our brain. Changes are due to an increase of gray matter volume in the periaqueductal gray, in the middle of the midbrain, in the thalamus, in the ventral striatum, and we have a reduced gray matter volume in the frontal region and precuneus. These changes that are seen with MRI are consistent and are in parallel with the dysfunction that we have in the